ranking A should choose numbers of different laws, should choose how it runs its health care. Is that one of the areas that that you would change?
Yes, health care has. All right.
That's a big topic these days.
It is a big topic because I don't have health care except what I do for myself. Now I'm competent. I know how my body works. I know what to do and what not to do. I haven't seen a doctor in 40 years. I don't intend to see a doctor in the next 40 or 60 years because I can take care of myself. I can make sure my body functions.
And you have the right to make that choice, and we want that to continue, that you have the right to make that choice.
Exactly. But in the healthcare, it has become so bureaucratized that people don't have the ability to make informed decisions because it's against the law to do this, it's against the law to do that, it's against the law to do that. But you know, it's against the law for me to tell you that, you know, if you took certain substances that are naturally grown, whatever, I could go to jail.
And herbologists have, there are herbologists out there that, you know, that, you know, for example, you know, St. John's wort or, you know, some other various herbs that you can get at some of the local health food stores.
Right.
If you were to give that to somebody for a health issue, you could go to jail for practicing medicine without a license.
Now, it's almost like the government has decided what is medicine and what isn't.
Not medicine.
Well, and that is the problem with the whole healthcare, and that's part of the large debate that's going on in D.C. is who's going to decide who gets what healthcare, who's going to decide how healthcare will be rationed, because with the government involved, it will be rationed. Remember price controls back in the 70s?
Oh, yes.
And we had rationing of gas and the long gas lines. Well, now we're going to have rationing of healthcare and long lines at the hospitals. Now, if we left it up to the private market, we would have more doctors, we would have more hospitals, we would have better health care. Now, are there any roadblocks that the federal government or state government puts in the way of building hospitals? We need, you know, here in Jacksonville we have quite a few hospitals, but there are parts of the states there's parts of the state that does not have enough hospitals.
Well, that's true, and yes, there is a primary roadblock that affects some of the states. It's not a federal issue, it's a state issue, and that roadblock is called a certificate of necessity. Now,
tell us a little bit about that certificate of necessity, John Lee.
Well, you have to have a certificate of necessity for almost everything you do concerning health care. That also goes to construction of buildings or even maintaining the buildings. I was speaking with a OBGYN at the St. John's meeting a few days ago, and he said, I started to say a little bit about it, and he says, you don't know anything. If you really knew what the problems were, you would be mad as hell, not just a little bit angry. But I did, a hospital down in Miami asked us to put some sunshades on their windows. Well, it took 4 years to get the permit to put that them sunshades up there.
Why would it take 4 years to get a permit to put sunshades on the window? You're talking about the film that goes on the window.
Outside.
The awnings.
Awnings. Right.
Well, that puts shade across the tables.
That has nothing to do with medicine or health care. It's just control. And that is exactly what the certificates of necessity has turned into.
How much do these certificates of necessity, it's even difficult for me to say, how much do these cost?
Well, they shouldn't cost more than the lawyer's fee to draw it up, which could be $1,000.
And for a hospital, that's not very much. You know, okay, this is a cost of doing business. We'll get, you want to take a look, and is another hospital necessary in this area? You know, for zoning.
That's true.
Well, I'm against to that particular, but does it cost $1,000?
No.
I didn't think so. I knew that was coming.
Sometimes it can cost $50, $60 million.
$50–60 million.
To get
How much does a hospital cost to build? It's not.
The certificates of necessity are generally more expensive than the actual construction cost of the hospital.
So the state government, for a piece of paper, I would imagine is the piece of paper is one, with a stack of paper underneath it.
Yeah, just barely, but yeah, I mean,
Right.
it's.
So it costs $50–60 million.
That's in lawyers' fees between the combating forces.
So other hospitals stop and try to stop.
Other hospitals saying, no, we don't need this hospital. It's going to cut into our profit. So a hospital 100 miles away can object to you building a hospital in your town because it's going to cut into their profit. It's going to cut into the fact that somebody will have another place to go rather than go to their hospital.
Right.
And so the actual mechanics of it, of issuing a certificate of necessity, is just really very simple. But by the time you get through with the lawyers for the combating sides, you have paid a great deal of money in lawyers' fees.
Right. And so what does that do to healthcare cost?
Well, of course, the patients are going to have to pay that. Now, recently, within the last couple of years, there was a hospital built in the Villages, which is north of Lady Lake in Lake County. And then there was the Demores Foundation Hospital built in Orlando. And each one of them had to spend 4 or 5 years fighting outside interest to get these hospitals built. Well, the hospitals were eventually built, but at great cost. And who's going to pay these costs? Okay, well, the people in Lady Lake who will use the hospital will have to pay a large part of this cost. But since 5/6 of this money was spent by hospitals in surrounding areas like Ocala and Leesburg and Orlando, the patients in Marion County and in Lake County and in Orange County will also have to pay a larger bill simply because the hospitals didn't want this other hospital.
Well, at the same time, most of the medical bills are paid by insurance companies. People go to the hospital, they have insurance. We're talking a large number of people that do have insurance.
Right.
And so the costs go up there. That means that has to be spread out amongst those of us that are thousands of miles away, hundreds of miles away.
Exactly. The insurance company is going to have to recover that cost, and they can't do it on an individual basis. Say all of the people in Orange County has got to pay an extra $10 because of this. All of the people in Florida, which at the time health insurance companies are limited to the state that they have a corporation in.
Right.
All of the people in Florida are going to have to pay an extra $10 to cover this extra cost.
This gives us a window into how, just in one instance, where government interference is raising the cost of health care and rationing health care, because the 4 or 5 years that it took to get that certificate through and then the extra year or so to build the hospital, that means the other hospitals in the surrounding area were overcrowded. So you had to wait for elective operations. You had to wait for medical care at those hospitals. So in that case, that gives us a good input as to how government interference is rationing health care. And we take that just from one local area here in Florida and take it to the national level. What do you think health care is going to happen at the national level? Do you think, as governor, you would be able to prevent that?
To some degree, yes. We would be able to change the way we do business in such a way that we could reduce, just by simply cutting out the lawyers' fees, we could reduce the cost of health care greatly. And as you said, it affects not only the hospital itself, because they have to charge more. It affects the insurance companies because they have to pay, they have to charge more, and they have to pay more. But I do believe that the certificate of necessity adds at least 6 to 7%, maybe even 10% to the cost of health care in different ways.